Hello everyone. Today, me and my team are going to talk about the healthcare system of Canada and Singapore. My name is Anay and my team is Silburn, AB, and Kulsum. The agenda for today includes the aspect chosen, healthcare finance and why it is important, the overview of the healthcare systems of the two countries, the strengths and drawbacks regarding the healthcare financing, the barriers of implementation in healthcare financing, and strategies or solutions to tackle these barriers, and a quick summary of the presentation at the end. What is healthcare finance? Good health is essential to sustained economic and social development and poverty reduction. To maintain and improve access to the healthcare is very important without being pushed towards poverty because of the cost of healthcare. To achieve universal health coverage, healthcare financing is very critical. The World Health Organization defines universal health coverage as ensuring that all people have access to needed health services that include prevention, promotion, treatment, rehabilitation, and palliation of sufficient quality to be effective, while also ensuring that the use of these services does not expose the user to financial hardships. Why healthcare finance is important. To achieve health coverage, the World Health Organization has stated three interrelated key areas. They include raising funds for healthcare services, reducing financial barriers to access through prepayment, along with pooling of funds in preference to direct out of pocket payments, and allocating funds or using funds in a way that promotes equity and efficiency. Development of these key areas is an important part of healthcare financing as they will determine whether the health services exist, whether they are available to everyone, and whether people can afford to use the health services whenever they need them. Now let's look at the financial statuses of both the healthcare systems of Canada and Singapore. The total projected healthcare expenditure for Canada in the year 2019 was $264 billion, while the total projected healthcare expenditure in Singapore was $13.4 billion, and in the same year of 2020, the Ministry of Finance included provisional funding for contingency plans and measures for prevention, containment, and control of COVID-19 by the Ministry of Health and Healthcare sectors in Singapore. The total expenditure on health as percent of gross domestic product in Canada was 10.4, while that in Singapore was 4.9. There are 2.5 practicing physicians in 1,000 population in Canada, while in Singapore it is similar, but it is 2 practicing physicians per 1,000 population. The out-of-pocket healthcare spending for Canada is $644 per capita, and hospital spending per discharge is $16,451. That data, unfortunately for Singapore, is not available. As everyone in the world knows that the use of EMR has been increased, in Canada, a primary care physician uses an EMR 73% of the times. But the use of primary care physicians, the use of EMR by primary care physicians in Singapore, the data unfortunately is not available. Now, Kulsum will explain us the strengths and weaknesses of both the healthcare systems in our aspect of healthcare financing.
For healthcare finance, there are strengths and weaknesses for both Canada and Singapore. The first strength of Canada in the aspect of healthcare finance is taxation. About 70% of Canadian healthcare services are publicly financed. With a healthcare system like ours, it is shown that the money that the government taxes the citizens is clearly being used to maintain the high standards of our excellent healthcare system. The funds go directly into making the medical program work for all citizens of the country. With this strategy, it provides equal access to most healthcare services provided to Canadians. Another strength for Canada is the global budget. Global budgeting is a method used by the Canadian Health Finance Department which correlates to putting spending caps on the health expenditures to make sure they have allocated proper amounts of money to specific regions where populations are high compared to where they're low. This allows for a foreseeable trend in financial spending so that policymakers are able to navigate around tough situations and not be at a standstill. One of Singapore's greatest strengths is healthcare expenditure. With Singapore investing a significant amount in its healthcare expenditure within the private and public sector, they are able to offer different programs which allows for the health and well-being of all citizens and tourists. MediSave, MediShield, and MediFunds are the three programs available to everyone, enabling them with the choice to opt in or out. According to the Ministry of Health of Singapore, MediShield Life is a health insurance plan which helps citizens pay for the medical bills. MediSave is what helps citizens of Singapore set aside money from their income towards healthcare needs, and MediFund is a way for the government to help fund for citizens who are unable to afford care. The second strength in aspects to health finance for Singapore is balance of public care and private care. With investments in both the public and private care, it allows for citizens to be able to financially weigh out what is affordable for them and what is not. After some research, people usually go to private clinics for day-to-day needs and to public clinics when it comes to bigger emergencies, which decreases the wait time and let physicians to provide emergency to those in dire needs of care. Weaknesses of healthcare finance. One of Canada's weakness in healthcare finance is global budgeting restrictions. When it comes to speaking about a budget, you're already able to foreshadow that when it comes to meeting the target budget, that the department will be looking to take a cut from somewhere. That affects the public in certain situations because health providers may start to limit the services that are offered and or implement restrictions and conditions on health services. Another weakness is provincial stance. In regards to speaking solely about healthcare, one thing you can definitely say is that when it comes down to healthcare and its availability by provinces, you start to see a disparity in the healthcare that's available to those provinces. Alberta, for example, is an oil-rich province which invests more in the healthcare per capita, therefore has more access to aid. One of Singapore's biggest weaknesses regarding healthcare finance is cost inefficiency. When it comes to having a full coverage for everyone, such as individuals or a whole family, it becomes a little bit of an issue. Within Singapore, the government operates healthcare programs such as MediSave and MediShield, which are coverage programs that provide extensive treatments and options for different needs, but even with those in play, the average Singapore citizen is not receiving the full coverage required. When that occurs, the citizens therefore see themselves spending in both public care and the private sector of the healthcare system, which puts a huge dent in their financial expenditure. The last weakness is cost disparity. The financial aspect for healthcare has citizens always in a state of uncertainty because of the cost of the healthcare comes from the political well-being of the market economy, which basically means when the economy is going bad, the cost of healthcare is going up, which it leaves those who are surviving on minimum wage stranded, not knowing what to do when they can't afford to keep it.
Now we'll look at barriers of implementation of health financing for Canada and Singapore. We'll start with Canada. The main barrier for Canada is its aging population. According to the Conference Board of Canada, seniors in the Canadian population will rise from 16.9% to 21% over the next 10 years. First point, by 2028, 93 billion will be added to the health costs. Cost of healthcare for the average senior is about $12,000 per year, compared with $2,700 per year for the rest of the population. Second point, federal funding does not currently address population aging. While providing healthcare is primarily the responsibility of the provinces and territories, the federal government shares responsibility for funding the system through Canada Health Transfers. The Conference Board of Canada predicts health transfers will grow at an average of 3.7% per year over the next decade. However, they expect healthcare costs to grow by 5.1%. Thus, the federal share of healthcare funding will fall below 20% by 2026. Final point for Canada: declining tax base, fewer tax dollars. Population aging is directly proportional to an aging workforce. Retirement leads to decrease in labor force participation and consequently a decrease in tax revenues. Now we'll move on to barriers of implementation for Singapore. There are three barriers. The first, no subsidies on new medicines if they are too expensive. Singapore has a standard drug list. This is a list of subsidized medication determined by the Drug Advisory Committee. If the medication is deemed cost-effective by the committee, then it will be placed on the list. Singapore does not subsidize all drugs for fear that it would lead to a rise in healthcare costs. Drugs on the list are subsidized by 50%. Second barrier: the amount of subsidies on hospital charges depend on income. Singapore believes that the person must take some personal responsibility for their healthcare costs, if they can afford it. The chart on the slide shows subsidies at public hospitals for the different classes of wards. Class A wards offer no subsidies, and they are the best quality. Class C wards offer subsidies from 65% to 80%. Hospitals use means testing to determine subsidies for hospital billing. This enables lower-income patients to enjoy more subsidies than higher-income patients. Hospitals check the income levels of patients hospitalized in Class C and B2 wards through tax authority records. Patients earning more than $3,200 a month would begin to see the subsidy decrease. At the highest income level on the scale, patients earning more than $5,200 per month will receive subsidies up to 65% in Class C. Non-working patients are not exempt. The tax authority uses the annual value of their home to determine income. Annual value is defined as the estimated annual rent of a property if it were rented out, excluding furniture and maintenance fees. Patients with homes below or equal to $13,000 in annual revenue receive the maximum subsidy. Above $13,000, they receive the minimum levels, 50% for Class B2 and 65% for Class C. Final barrier: health financing from Medishield and Medifund depends on personal health choices. Singapore has a list of pre-existing conditions due to lifestyle choices. Examples of these conditions are alcoholic liver disease, coronary artery disease, or even HIV. If you apply for Medishield, which is an optional insurance coverage for Class B2 and C levels in public hospitals, you will need to pay a 30% additional premium for the first 10 years. If you apply for Medifund, which is a government endowment fund for aiding the poor, you will be denied.
Thank you, Silvan. Let's take a look at the strategies to overcome the barriers for Singapore first, and then we will look at Canada. So, developing a robust health insurance model, including pharmaceutical coverage. So one of the barriers that was suggested by Silvan in the previous slide was the incurred cost where were supposed to be paid by the end users for pharmaceutical products. So developing a more robust health insurance model would substitute this and would make the health more accessible there. The second point would be to cut down expenditure on medication. Here what we mean is to cut down the expenditure on medication at the source. So that would be either to create an economic stimulus package for generic drug development, or robust trade deals with generic manufacturing hubs like India. This would lead to the decrease of cost for medication per se, and it would also end up helping for having a better coverage in health. The third one would be public health undertakings for adoption of better health choices. Here there are two approaches. One would be to reduce the tertiary care expenditure. The above mentioned points, such as health insurance and better medication models, would help in that. And the second one would be to increase the availability of hospital beds, which would come as a direct result of public health undertakings where the general health and welfare of the patient is is um, uh, is maintained, and they avail the hospital facilities considerably less. Now let's move on to the strategies to overcome barriers in Canada. The first and foremost would be immigration, and immigration has been the cornerstone of Canada for some time, and that should be the way in which it should go forward as well. Given the fact that the majority of the population in Canada is aging, the strategic increase in tax-paying workforce that could be achieved by focused immigration can result in a great influx of taxpayer money into the system, which would then again channeled to develop more health facilities. Second one would be to increase healthcare capacity. So that would include increasing infrastructure, creating more hospitals, more long-term care homes, etc. Personal, that would be hiring or training more healthcare people, which is more evident at this time of crisis of COVID-19. We can see that we have an acute shortage of health personnel. We came to the knowledge that in the last 150 years in Canada, not even one new university for medicine has been started. Um, the third one would be to focus more on research and development, and the fourth one would be to implement effectively more health information technologies so that mass access to health could be provided. The next one would be to implement better taxation policies. So this is key. If you We can see new taxes that have been proposed. For example, the super wealth tax, which was proposed by the NDP government last year, that would be taxing 1% of on fortunes of more than $20 million. This money could be potentially used for developing healthcare systems here. The next one would be to have a stricter taxation laws. The Office of the Parliamentary Budget Officer produced a report in 2019 which said that the loss of economy in Canada is around $25 billion in 2019 due to tax evasion. The next point would be to create private equity into the healthcare domain in general. I just wanted to be clear here that it's private equity, not privatization. So the system would remain the same, but more investment from the the private sector can be incorporated into the health system. So in conclusion, Canada and Singapore are compared in the study and are having a vastly different approach to healthcare finance. Although not perfect, both countries have good track record of managing their health finances. In terms of healthcare expenditure per capita, Canada does an exceptional job than Singapore because there's a higher population here than compared to Singapore and a vast geographic area to cover. Canada faces more difficult financial challenges than Singapore, considering the population and again the geography of the country. Canada has more administrative challenges as there is a collaboration between the federal and provincial government in terms of healthcare delivery. While Singapore, being 100% urban, it's under a single authority and which is streamlined more. Both countries face an increasingly aging population and a marked decrease in the segment of population contributing to taxes. This is the single most biggest barrier that is faced by both countries in terms of finances. With the judicious implementation of strategies to overcome the barriers, these issues could be mitigated, and both countries can even better their healthcare systems. I will thank you for your time. Thank you for listening to us.